Thank you. Dr. Katz.
Well, Senator, thank you so much for including me. I've appreciated listening to the questions, listening to my colleagues. I think there's a lot of agreement. In particular, I think we would all agree we do want to minimize the total harms of this, even if there's some disagreement so far based on the best ways of doing that. We've also posted a lot of materials online at my nonprofit, truehealthinitiative.org. We have risk models. We have arguments there for this total harm minimization approach. And I think it allows for a range of opinions about what's the best way to get there. I largely agree with my colleagues that we have the needed information to risk stratify the population, but I would argue it's crude risk stratification at this point. We know elderly people with chronic disease are at high risk. We know young, healthy people are at lower risk. But is a 40-year-old with mild obesity or mild hypertension at higher or lower risk than a 50-year-old without those conditions? There are a lot of combinations where I think we really do need representative random sampling. So a particular plea to you in your capacity as chair of this committee that the federal government implement a policy of representative random sampling. We don't need millions of tests. Let's do 50,000 tests, but let's make sure we do them in a population that represents all of the United States. Second thing is we do need a health promotion campaign because we can't modify age, we can't modify sex, but we can modify many of the chronic disease risk factors and many of the lifestyle practices that are influencing the acute risk for COVID. So these chronic liabilities that really were a huge drag on health and vitality and, for that matter, the economy in America all along are now an acute threat as well. And I think part of the return to normalcy policy ought to be we're going to help everybody get healthier so you actually come out of this stronger. There's an acute benefit, there's a lasting benefit. So those two requests really for the federal government, representative random sampling, so we're flying through a less dense fog, and a nationally coordinated focus on helping to alleviate the burden of chronic disease that is now an acute liability too.
Thank you, Dr. Katz. Before we go to our final witness, I just want to point out, I was the guy that championed right to try. I'm a big believer in letting doctors be doctors to practice medicine. There's nothing that is universal. And certainly in this case, one of the reasons I've been pushing that so hard is an effective therapy, an effective cure will break the back of this disease almost overnight. It'll end the economic crisis. And so that's why I really did invite Dr. Kory, because I was very encouraged by the work he and his colleagues were doing once people became hospitalized. But again, I really want to make sure that we're also pushing the envelope, allowing doctors to prescribe off-label. Let's not restrict their use. It's what we've done with hydroxychloroquine. Again, I don't know that's going to for sure work. There's an awful lot of anecdotal evidence. But again, I really want to make sure that we continue to support doctors like Dr. Kory and others that are, again, practicing medicine, exploring different theories of this case. The sooner we can end up with an effective therapy or a cure, again, we break the back of this disease, this crisis, this horror almost overnight. So again, turn it over to you, Dr. Kory. Give us a little bit more hope and keep practicing medicine.
Yeah. No, thank you, Senator Johnson. And you and I have an affinity on this. I totally agree. The gloves need to come off. This disease is wicked. It's really, I get confused when people are comparing this to the flu. I've been a doctor in an ICU for 15 years. There's nothing like this disease. Let's stop comparing it to other ones. I have patients filling ICUs with fibrotic lung disease who I cannot ventilate without deep sedation and paralytics because their lungs are destroyed. This is not what the influenza does. This is a completely different disease in the sense that its acuity, its severity, and its rapidity is unlike any other that I've seen. It doesn't mean I can't handle it. I know I can treat this, but you gotta let me do it. We gotta get it earlier. My problem is that everybody looks at the ICU doctors to solve this. It's not the ICU doctors. We just need to move more powerful therapies a little farther out. We need to get it in the ED and the hospital wards. I promise you we can avert this tragedy of fibrotic lung disease and ventilators. I know we can do it. We need to have a much more robust treatment strategy. The other issues, I gotta say, I totally agree with Dr. Inglesby. Again, I don't want to be outside of my lane, but like the prevalence and this herd immunity stuff, I don't know about that. That's not what I'm expert at. I get the whole thing about balancing between saving lives and continuing life, which is economic activity and financial activity and all of that, I don't really know the answer to that. But I really do believe that if we can find an effective solution to prevent the deadliness of this disease, it would mitigate and it would help everything else. And that's what I'm just trying to promote. I think we can do this. We have effective therapies. I'm getting increasing reports of really good responses to treatments. And like you said, Senator, we just need to be able to treat these things. And everybody has to stop thinking that we need to do everything in randomized controlled trials and this is experimental and dangerous. We know what we do. And I don't know, if we come up with an effective medical therapy, this would mitigate a lot of the harms of everything that you guys are talking about, which is opening or closing or not. I just got to say, I'm a doctor. I work in a hospital, and I really believe